Hi, I'm Rachel King and I work as a Research Associate at the University of Sheffield, Division of Nursing and Midwifery. I'll start by telling you a bit about my background and then introduce you to the topic of this presentation. I've worked as a nurse for about 20 years and most recently as an advanced nurse practitioner in primary care. And as you can see from my photo, in addition to working, I also enjoy being outside and running in the beautiful countryside around Sheffield. For the past 2 years, I've been part of a team funded by and in strategic research alliance with the Royal College of Nursing. And our research areas focus on nursing workforce issues, including new roles such as advanced nurse practitioners and nursing associates, CPD, continuing professional development, safe staffing and missed care. This presentation will focus on our programme of research on the Trainee Nursing Associates. I'll give you a short background to the development of the NA or Nursing Associate role, and then I'll talk about the longitudinal mixed methods that we are using over the 3-year study. I'll present some of the findings from the first year survey, and then talk a little bit about how COVID has impacted Trainee Nursing Associates, or TNAs as I'll call them from now on. And that was an addition to the Year 2 survey. Firstly, some background. As you can see from the diagram, there was a perceived gap between healthcare assistants and registered nurses. So the Nursing Associate role was developed following the Shape of Caring review by Lord Willis, with the aim of filling this perceived gap and also to provide an alternative route into nursing, so to boost the nursing numbers, because we have a shortfall of about more than 40,000 nurses. And other high-income countries such as the US, Canada, Australia and New Zealand have maintained a second level of nurse training within their healthcare systems. However, in the move towards an all-graduate nursing profession in the UK, the training of our second-level state-enrolled nurses was discontinued in the 1990s, and gradually the role was phased out. It's important to note that we do have another support role called the assistant practitioner in the UK. But that role isn't regulated and works across a range of healthcare professions and settings. The Nursing Associate role is regulated by the Nursing and Midwifery Council, and they have their own standards of proficiency. Now, some assumptions were made regarding the NA role. Firstly, that 50% would transition to become registered nurses. And secondly, that transition would be smooth with lower attrition rates compared to other traditional student nurses. And recent research has shown that attrition amongst student nurses results from financial pressures, unmet expectations and a lack of clinical support. This study aims to test the assumptions made about nursing associates and also understand the factors important to them during their training and beyond. Our study design is a longitudinal mixed methods cohort study over a period of 3 years, collecting data from annual surveys and interviews and diary data. And we're following the same TNAs over the 3 years into their early work as nursing associates. We're also collecting data from stakeholders across universities in England, but that analysis is still ongoing, so is not included in this presentation. The TNA cohort was recruited through contacting university course leaders and via social media. 132 TNAs completed the Year 1 survey. The survey questions and interview guide were developed following an exploratory study using focus groups with TNAs, which we undertook in December 2018. And this has been published with a reference given on the final slide. The survey included questions on workplace well-being, job satisfaction and identity, and they were developed from previously validated surveys. This first survey was completed between April and November 2019 via Google Forms, and it was analysed using SPSS software. The qualitative interviews with 14 TNAs across England were undertaken in January 2020 using telephone interviews, and that data was analysed with the help of Quirkos software. Now I just want to tell you a little bit about the demographics of the cohort. Table 1 shows the demographics of survey participants. As you can see, the majority of TNAs completing this survey were female, were aged between 20 and 40, and were white British. And there was a geographical spread, as you can see by the map, across England, with the red pins showing the areas where the participants were based. And Table 2 shows the demographics of interview participants, and they were purposefully sampled to ensure diversity of age, gender, ethnicity, region across England, and previous healthcare experience. And in addition to being interviewed, we've also asked them to complete diary entries on specific experiences or moments of reflection that they see as significant in terms of their motivations and their experiences. However, we haven't included the diary data in this presentation. So now I'm going to talk about the findings that have come out of the Year 1 data, both the survey data and the smaller interview cohort. Firstly, TNAs were motivated by affordable local career development. 85% saw the training as an opportunity for career progression, and 67% were attracted by the funding attached to training. It just made so much sense in so many ways, because it meant that I could still continue my journey of wanting to become a registered nurse eventually, but do it in a way that was better designed for those that had commitments financially. And 72% of TNAs saw this as a route into registered nursing. However, fewer than half knew how to access the top-up course to become registered nurses. One of the drawbacks is at the moment my trust is not offering that top-up, and I think it's because they want to keep us at a band 4. And the second key theme is related to academic and clinical challenges. TNAs have to juggle their clinical work with studying, which some found overwhelming. The pressures of working and the study and trying to achieve the modules and having that time it takes is very good at making you realise about time management and balance. Now, most TNAs, 91%, had previous experience working in healthcare, with only 9% coming from a non-clinical background. And one TNA said, we started with 40, but now we're down to 22. And out of that, we've only got one person left that didn't work in healthcare prior. Most people that have left have come in from not having a healthcare background. Now, we know that one cause of attrition in student nurses is our lack of support, emphasising how crucial it is to understand TNA experiences. 50% of TNAs worried about lack of clarity in their role. Because it's a new role, nobody really knows what a TNA is. So we're basically saying, well, it's like a state enrolled nurse, because then they have an understanding. It doesn't matter how many times you try and explain the difference between a nurse and a nursing associate. Some people are just not getting it. And role ambiguity has been identified as a problem in previous studies of similar roles, such as the assistant practitioner role. TNAs are facing significant challenges in meeting both the academic standards of the training while working in practice alongside managing their own and colleagues' ambiguity about the role. And we'll follow these issues across the 3-year project in order to identify how best to support this new group in healthcare workforce. Now you might be quite interested in the next couple of slides, which show our early findings on the impact of COVID on TNAs. 64 TNAs completed the Year 2 survey, in which we incorporated additional questions relating to the impact of the COVID pandemic on their work and learning. And the survey showed the results which you can see in the table. So 70% felt safe at work, 55% said they had experienced an increase in workload, although 14% had a decrease in workload. 75% felt they were still able to produce the same standard of care, and 44% said they had to work overtime. 24% worked beyond their usual scope. And we'll explore this further in relation to the qualitative themes as well, which showed the impact of COVID on training and development, patient care, workload, and well-being. The impact on training included cancelled alternative placements. Staff were sometimes too busy to supervise the development of new clinical skills, and some TNAs were being asked to work as healthcare assistants, and in other cases training was suspended. And there was also an impact on the delivery of patient care, which included a role in reassuring worried patients who were not able to have visitors. Some TNAs felt out of their depth because they had to care for very unwell patients, which they were not used to doing. But despite this, there was a determination to continue providing the best care they could. And this is illustrated by this text from the survey. We had one young man that came in for an emergency operation. He was quite overwhelmed and wanted his family there. Due to COVID, this could not happen. I reassured him, told him I would be there throughout his operation, and I went to see him on the ward after. And this was quite a long piece of text on the survey, where she went on to say she visited this patient the next day as well, just to give him that extra reassurance in light of the fact that his visitors couldn't come and see him. And there was also an impact on workload. This included an increase in workload due to staff shortages. Some TNAs did overtime, but in other cases it was reduced due to fewer or no patients in that particular setting. Some TNAs were redeployed and others were given cleaning duties. And this is just illustrated by the text. So in one example, lots of staff were off sick, meaning that we were very stretched at times and had to move areas frequently. And I always do my utmost for my patients, even if it means working overtime often, which was paid during COVID-19, but now things are easing, I still stay until I finish what I need to, unpaid. And the impact on well-being was quite stark. TNAs experienced the stress of keeping up to date with changing PPE policy, and they experienced anxiety around protecting themselves and their family from COVID. And this is illustrated by this quite upsetting piece of text from one TNA who wrote, "I had serious concerns for my safety as my father has died from COVID and my mother also contracted it, and they work in the same trust as me." So in conclusion, recruitment and retention are a huge priority for health and social care. We need an emphasis on local affordable development opportunities to encourage further recruitment of trainee nursing associates. The data shows that TNAs struggle with a lack of clarity and support in their role, and COVID has only added to these challenges with reduced training and fear of COVID. However, TNAs are providing comfort to their patients and support to colleagues. A clear career pathway is crucial to enable TNAs to reach their potential and transition to registered nursing. Knowledge about these motivators, key challenges and aspirations will inform strategies to improve recruitment and retention, and the findings will contribute to the global evidence on the development of new nursing roles in similar healthcare systems. And I'd just like to thank you for listening. And on this slide, you'll find a link to our paper on the focus group exploratory study. And also I'd like to thank my colleagues who've contributed to this piece of work: Emily Wood, Michaela Sennick, Steve Robertson, Bethany Taylor, Angela Todd and Tony Ryan. And if you'd like to contact any of us about this work and other pieces of work, then please use the email address provided or contact us on Twitter, and you can read more about our research on the website provided. And we'd love to hear from you. Thanks for listening.